Appreciate you being here for this very important meeting. My name is Donnie Lambeth, and I'm chairing this meeting this morning. I would like for you to recognize with us our pages, and you guys can stand as I call you out. Audrey Dimick, Andrew Gilmore, Hika Kyran, probably messed that one up. Hilmi Torbeck, probably messed them all up. We appreciate y'all being here and spending the week with us, and hopefully you'll find this a very enlightening experience. And we also want you to recognize our Sergeant of Arms, who always do a great job, Terry McGraw. Thank you. And Nina Lige, Thomas Terry, and John Kostick. Thank y'all for being here as well. We're going to start, and we do have actually several of the bills that have PCSs. We're going to start with House Bill 389, Child Care Workforce Pilot Program Funds. It does have a PCS, so without objection, the PCS is properly before the committee if that's acceptable. And with that, I'll call on Representative Arp.
Thank you, Mr. Chairman. Thank you, colleagues, for allowing me to present this fantastic bill before you today. This is, no, it really is. I'd like to thank my sponsors, Chairman Lambeth, Bell, and Strickland, too, and you'll find out why in just a minute. They're key parts of this. This bill is also the result of a collaboration of a lot of entities, North Carolina Licensed Child Care Association, the community colleges, the chamber itself, the Partnership for Children, Smart Start, Home-Based Child Initiative, and the YMCA Alliance. And so I want to thank them for working with our office to make this. What this bill does is provide funding to lead academies that's happening in Wayne and Johnson, and we're wanting to provide 10 additional academies across the state. What this does is the academies accelerate and reduce the time for students to complete the required community college course, EDU 119, which is the required course in order able to be a lead teacher in child care. One of the challenges that we have is staffing challenges. And so what this bill attempts to do is open up the pipeline to assist more lead teachers in becoming slots filled for there. Instead of taking a 15 to 17 week course, the students can complete the course in 2 to 3 weeks, commit to attending class 5 days a week for 8 hours a day, and goes on down. The course is offered to students at no charge. The students will receive breakfast, lunch, and snacks at no charge. As part of the program, the students will also receive the required health screening, fingerprinting, and background checks at no cost to the student. And then after completing the portfolio, it gives them necessary credentials to be hired as a lead teacher. Those individuals who complete the academy and then teach in a child care within the stated period of 1 year will be eligible for a $500 stipend. So we are trying to open this up and come at the child care issues from a lot of different ways. Some of them are regulatory changes, some of them are also money, but this is an innovative project based on something that's working in Johnson County and Wayne County, where Representative Bell and Representative Strickland are, and we want to extrapolate. I stand for any questions. What this bill does, has the potential to create nearly 1,000 new lead teachers. And since you cover 8 to 10 students, each lead teacher, you'll be covering 8 to 10,000 new child care students with this. So that's the magnitude, and I appreciate your support.
Committee members have questions?
Chairman.
Representative Pierce.
Thank you, Mr. Chairman. Thank you, Representative Arp. Did you say 10 additional counties, academies will be added? I don't have the bill in front of me, I apologize, but what are the next 10 counties? Am I answering the question right?
Yes,
What you said, okay.
we want to do it across 10 more counties. I don't know that they're selected in the counties.
Thank you, Representative.
Representative Sylvania,
Thank you, Chair. May I ask the bill sponsor a question?
you may.
Representative Arp, we saw that the change between the original bill and the PCS was a change in how this would be funded. Why was that decided? And what is the amount that you would see the appropriation should be to fund this effort?
Because I'm on the appropriations and I know nothing moves without appropriations getting the budget bill first. So what I did was change the bill pending the passage of the budget so that you could vote positive on this bill and it moved forward. And then we'll work out the budget later on. This is about $750,000.
Representative Potts, you have a motion?
I do, Mr. Chair. I move for a favorable report to House Bill 389, unfavorable to the original with a referral to rules.
You've heard the motion. All those in favor say aye. Aye. Any opposed? I am trying to move fast because we've got about 15 signed up to speak on bills that's coming up. So we're going to try to move as many of those as we can as well.
Thank you very much.
And I don't think that was terribly controversial. Thank you, Representative Arp. We will hear House Bill 471, the Food Labeling Transparency Act. Representative Gillespie. This is also a PCS, so without objection, the PCS is properly before the committee. No objection. It is properly before the committee.
Thank you, Mr. Chairman. Good morning, committee members. House Bill 471 is an act to prohibit misbranding of certain food products. First, I would like to acknowledge and thank my co-primaries, Penny, Loftus, and Honeycutt on this bill. What this bill does, or why it's necessary, I should say, is that, as you know, manufactured protein food products are a newly emerging product in this industry. And we need to make sure that those products, as well as all products that are consumed by the public, they're made aware of what these products actually are. There's this bill. Let me just speak for a moment on my background, because I think that might be helpful. I've been in the cattle business the better part of my adult life. I grew up on a dairy farm, and one of the things that I think that we've been able to do in agriculture, and in particularly in the business that I'm in, the beef business, is we've been able to deliver a safe product to our folks. And one of the things that our industry started doing years ago was making sure that consumers understood where our products came from, how we grew our products, how we handled our products, and the process to get the products to them. And that goes all the way to letting them know what's in that package that they're buying. And there was some discussion with our industry about whether that was a healthy thing to do. I felt like it was a healthy thing to do then, and the statistics clearly show that it was the healthy thing to do, because what we have found is consumers are becoming more and more educated every minute, every day, every year. And when they go to the grocery store or they go to a restaurant, they have food in mind that appeals to them. And what we were trying to do with this bill is to provide labeling that indicates that. This bill is not to single out, to promote or oppose any particular industry. This bill is created for the sole purpose of letting the consumer make their choice. We believe the consumer has the right to know what they're going to consume, and this bill is designed to do that. Nothing more, nothing less. I will tell you that staff has done a fantastic job working on this bill. The fact that none of them quit during the process of 16 revisions is, I can't tell you how much I appreciate that. And starting on about the 6th revision, I said it's just one more revision. So we have met with anybody and everybody that we felt like would have an interest in this bill and what we were doing. We've worked with many groups to get everybody that we know of on board and with this bill. So, Mr. Chairman, I stand for any questions, and committee, I ask for your green vote.
Committee, are there questions? We'll take a few on this one as well. There is no one signed up to speak on this bill, so we do have a little bit more time. Biggs, excuse me.
Motion at the appropriate time, Mr.
Okay.
Chairman.
We'll hold you for that. Any questions? Representative Pierce.
Mr. Chairman, is this the same bill that Representative Dixon has? What was the difference, if you don't mind me asking? What was the difference? Jimmy Dixon introduced the same bill. Is that right?
I think that's a good question, because I think I've had a number of people ask me that, so we'll let you, Representative Gillespie, respond to that.
Thank you, Mr. Chairman. I don't have bullet points of each bill, so I can give you an exact comparison, but I will tell you this bill has some of the same things in it that some other bills that you've seen. There's some things that are different in this bill that we learned through that process where people had some concerns, and I'll just touch on one particular one, and that is the size of the label. There was some language that was discussed in the other bills that talk about the size of the language, the font size. What our bill states is it will be consistent with other labeling. We don't want it to be so big that it takes the label over, and we don't want it to be so small that I can't read it with my glasses. We want it to be consistent with other.
Representative Pierce, I think we can actually ask staff to maybe add a little bit too. Yeah.
Thank you, Mr. Chair. Jessica Boney, Legislative Analysis. Representative Gillespie, you're correct. And I would just add that this bill, it limits the manufactured protein food products to only the cell-cultured food products or insect protein food products. It does not include the plant-based food products that I believe were the subject of some controversy at the last hearing for Representative Dixon's bill, as well as this bill addresses how these items are listed on a restaurant menu, which was not included in Representative Dixon's version. Thank you.
Representative Crawford.
Thank you, Mr. Chair. I just have a comment on this bill. I just want to say thank you to Representative Gillespie for removing that 20-point font out of the bill. I was of the opinion that was a bit excessive and put an unnecessary burden on the packaging manufacturers, especially those who were sending them out to multiple states. And so I appreciate you making that change.
Thank you.
Other questions? If not, we have a motion. Representative Biggs.
I move that the PCS for House Bill 471 be given a favorable report and an unfavorable to the original bill, with a referral to agricultural and environmental and a referral to rules.
Also has a referral to commerce and economic development. Was that in your motion? I believe it was, wasn't it?
Yes, sir, it was.
Got you. Okay, you heard the motion. All those in favor say aye. Any opposed? Congratulations, Representative Gillespie. It does pass and move to the next committee. We'll skip the work requirement for the time being because the other two have some interest from the public. House Bill 152, access to transcranial magnetic stimulation. Representative Honeycutt. And then we'll
Thank you, Mr. Chairman, members of the committee. I'd like to thank Representative Lambeth, Potts, and Dr. Reeder for being on this bill with me. What House Bill 152 does is require insurers who cover TMS to cover it regardless of the type of healthcare provider performing the procedure, as long as the healthcare provider acts within its scope of practice. I would appreciate your support.
Committee have questions? We do have a few who have signed up in the public, which I will allow on this bill. At this point, no questions from the committee. Representative Campbell, Dr. Campbell.
Just motion at the appropriate time, Mr.
Okay, we'll hold that. We do have several who've signed up. We can start, let's see, we can start with, make sure I catch them all. Tammy George. And then we'll have Mason, Lowry, if y'all want to gear up and be in waiting, and then Daniel. I think that will cover all those who are asking to speak on it. We'll allow you 1 minute if you could touch on your issue real quickly.
I'd first like to say thank you for pushing this through. It's something that's very near and dear to my heart. House Bill 152 it would change more lives like it changed my life. Transcranial magnetic stimulation, that is. Lifetime of depression, thought it was situational and acute until I had two very traumatic events happen in my family and I work in healthcare, I'm a nurse, where I couldn't get out of bed to go to work. I started transcranial magnetic stimulation, and within 4 to 5 weeks, my family noticed I was a completely different person. I'm years out from treatment. I'm a very successful businesswoman now. I own a consulting firm, and it's just gonna make such a big difference for providers that are not psychiatrists to be able to offer this therapy. Because if you think about being referred out to a specialist with your own insurance, you have to see your primary care. You go to your specialist, you have to wait weeks. So this is profound. Thank you.
Thank you for those comments. Ms. Mason? If not, since Peter Daniel is, okay, here's Ms. Mason.
Hi, my name's Nicole. This bill will benefit patients under the care of physicians other than psychiatrists, as well as primary care providers who are treating patients with depression that have nowhere else to send their patients. We currently operate 8 clinics in North Carolina, and we would be able to open more, except there's a lack of providers that can administer this treatment. Payers in North Carolina will only credential psychiatrists currently. However, any trained provider can do this treatment safely and effectively. TMS therapy has an 83% response rate as well as a 62% remission rate. This treatment is already being reimbursed by payers in North Carolina. However, we need to expand the physician access and change eligibility requirements to allow primary care providers to administer this treatment. The treatment is 36 treatments, 19 minutes a day, 5 days a week for 7 weeks. So patients really need to be within 15 minutes of a clinic in order to have access. In North Carolina, there are 100,
Yeah, if you'll wrap it up.
Thank you.
Thank you. Now, that was Nicole Lowry. Rachel Mason, you still here? You can get in line. You can come back up. No, okay. Peter Daniel.
Thank you, Mr. Chairman. I'm Peter Daniel, the Executive Director of the NC Association of Health Plans. Every member of my association covers this very valuable therapy. We are concerned that this is more of a scope of practice issue rather than an insurance company payer issue. And if the practice is credentialed, we are happy to pay for the procedure. But as the bill is written, this turns it into an insurance company issue versus a scope of practice issue. And we respectfully ask that the language be adjusted. Thank you very much.
Thank you, Mr. Daniel. I think that covers those who had signed up, unless there's someone else I missed. If not, committee's heard those comments as well. Is anything, Representative Honeycutt, you'd like to add? If not, I'll go to the motion with Representative Campbell. Motion.
Thank you, Mr. Chairman. I'd like to make a motion for a favorable report for House Bill 152 with re-referral to insurance and a favorable referral to rules. Thank you.
Committee's heard the motion. All those in favor of that motion say aye. Any opposed? Thank you for that, and it does pass. We'll move on to the next committee.
Thank you, Mr. Chairman, members of the committee.
House Bill 163, Pharmacy Benefits Manager Provisions. This also has a PCS, so without objection, the PCS is properly before the committee, and we will hear from Representative Ryan.
Thank you, Mr. Chairman. Colleagues, the PCS before you today comes after countless hours in my office with PBMs, as well as a stakeholder meeting among several PBMs, insurers, pharmacists, and representatives from independent and chain drugstores. While we certainly do not agree on everything, I have tried to foster a dialogue that I hope will continue as we all seek to lower healthcare costs, especially prescription drug costs for the people of North Carolina. I want to thank the other primary sponsors on the bill, Representative Blackwell, Lowry, and Honeycutt, as well as the staff. They have been very patient with me through this process. Also, thank you to Representative Cunningham for her input on this bill as well. The bill before you, House Bill 163, is very similar to what you saw 2 years ago, passed unanimously in the House. And as more and more chain and independent pharmacies go out of business, access to health care becomes a greater and greater need. We must do something to help the people of North Carolina. Key provisions in this bill prohibit spread pricing from PBMs, require transparency on concessions. PBMs must report fees, discounts, and rebates they receive. It ensures fair reimbursement. It prohibits PBM self-preferencing. PBMs cannot reimburse their own or affiliated pharmacies more than independent ones. It allows patients a right to their pharmacy of choice. It provides audit protections and implementation and oversight, as well as in Part 4, Representative Cunningham asked that we add the provision that would make it applicable to health benefit plans do not apply to self-funded plans offered by local governments. Thank you, Mr. Chairman. I'll stand for any questions.
Thank you. See if the committee first has any questions. We have 4 who've signed up in the public. While you're looking, I'm gonna call on Representative Cunningham.
Thank you, Mr. Chair. At the appropriate time, a motion.
Okay. Representative Potts.
I have a question, Representative. I've had people from both sides of the conversation in my office, and I ask questions, and I get diametrically different answers a lot of times. But is there a dispensing fee of $10.25 on every prescription, regardless that the insurers and the people would have to pay? I've heard conflict on that, and I'd like to know, please.
Representative Ryan.
Thank you for that question. I know a lot of us have gotten emails, and while I have absolutely mad respect for the deceptive sleight of hand in the $10 tax emails that many of you have gotten, that is simply not true. There's no new tax in this bill. There's not even the word tax in here that I'm aware of. If you can find it, you let me know. What it simply is, what they are referring to is pharmacies for decades always have sent and asked for payment for the cost of the medication plus a dispensing fee. And what I would relate this to is if you go into a doctor's office and let's say you sprain your ankle and you go in and they say, it's a really bad sprain, we're gonna wrap your ankle and here's a boot. You would expect that doctor's office to submit to the insurance company for the wrap, the boot, and the professional dispensing fee for their time and their service. This is nothing new for a pharmacy. We have always submitted for a dispensing fee. We are simply just not being paid.
Representative Shepherd.
Thank you, Mr. Chair. Representative Ryan, like many here, I've received a ton of emails, and some are opposed. They say it's going to cause the drug costs costs that go up, so on and so forth. And the second question part of that is, does this also apply to our small local drugstores and pharmacies that aren't listed on your list here?
Absolutely, it does. The list that you have before you, and I've given you all of packet, just some more information if you'd like to dive into it, shows the vertical integration that we have. I think that's what you're referring to, but this bill absolutely encompasses our small independent pharmacies.
You good on that? Representative Ball?
Thank you, Mr. Chair. I would like to ask someone, whether it's the staff or the bill sponsor, perhaps a couple of questions.
Why don't you ask the questions and we'll see who's best to handle those.
All right, thank you. We're all concerned about the cost of health care, medication and so forth. Can you explain to me what in this bill lowers health care costs, which is how this bill is described by many people?
Representative Ryan, you want to tackle that one first?
I'd be happy to answer that question. This bill actually provides transparency to show people where the taxpayers where their money is going. It provides transparency in a system that is broken. And overall, I think maybe there wouldn't be as hard of a fight against it if they wanted transparency. So I think PBMs came on the market in the 60s, geared up really in the 90s, and their number one goal has been to reduce the cost of healthcare and prescription drug prices. I don't think we've seen that happen. I choose to believe that the people of North Carolina see through the deceptive measures and the talking points that we've used for years in this process.
Second question.
Yes, thank you. We have 800,000 state employees and retirees in North Carolina. Does this bill include those employees?
And I'm going to direct that technical question to staff to make sure you get the correct answer.
Staff.
Jason Moran Bates, Legislative Analysis. I do not believe this applies to the state health plan.
Follow-up question?
Yes, why doesn't it?
There have been concerns in the past, I think, as to ERISA. I think that's being litigated at this point. This has not been in the bill in the past.
Good on that. Representative Crawford?
I don't know that I have much more to add to what Representative Ball said, but maybe just a couple of additional questions. Mr. Chair.
You can start your questions.
Thank you. First, Representative Ryan, thank you for working on this bill. I know that this has been a lot of work, and I really appreciate what you said about transparency. I think having transparency across these spaces is really important. I want to go back to, how does this bill lower the out-of-pocket cost for our constituents? And let me, before you answer that, preface just, I think we all of us in this space, us in the General Assembly, our health plans, our PBMs, our pharmacists, everybody, our hospitals, everybody who works in this healthcare space, I think we all have a responsibility to figure out how we can ensure accessible, affordable healthcare to the people of this state. And we know that healthcare is just too expensive. And so what I'm trying to understand is how this bill really helps us address some of those healthcare costs and those specifically out-of-pocket costs to our constituents.
Representative Ryan.
Thank you for that question. Currently, PBMs are the middlemen, so to speak, between the insurer and the manufacturer. There's actually incentive for PBMs to go to the manufacturer and there be higher cost drugs on insurance companies' formularies because they get a bigger rebate. Those rebates are being held there in the middle. They're not being passed on to the consumer. This bill would cause those to be passed on.
Follow up?
So those costs will be passed on to who? I just want to make sure I understand.
The rebates that the PBMs are holding would be passed on to the consumer.
Oh, the rebate. So the consumer would get the rebate.
Sorry if I said that incorrect.
That's okay. Do we have a mechanism? You probably said it correctly, and this is a lot to take in. So thank you for re-explaining it. Do we have a way? Does this bill create a mechanism for us to really track those costs and make sure that this bill really has the intended effect that you're seeking?
That's the transparency piece of this bill, and the reporting and the requirements that are in this bill currently is really one of the larger parts of this bill that I think will open the eyes of everyone for sure. And if staff wants to address that further, I'm happy to.
Staff have any comments? No good? Representative Servania.
Thank you, Chair. May I ask Representative Ryan a few questions?
Can.
So, again, thank you so much for iteratively trying to improve what our situation is. You know, we all recognize it is broken and it's very confusing. I also recognize that we need everyone. We need, at this point, PBMs. We need our pharmacists in our urban areas. We need our pharmacists in rural areas. But we are elected here because of our people. I'm gonna jump off what Representative Crawford said. You say transparency, but that's just be able to see what's happening. That doesn't guarantee that rates would be towards our consumers. And it's been said that these rebates are going to consumers, but we all know this is for-profit companies. We can't guarantee that any cost savings will go back to our consumers. So my question first is, do we have an enforcement of this? Is there any way to regulate it, and is it in your bill currently?
Representative Ryan.
Thank you, Mr. Chairman. At the end, there is the Department of Insurance and the North Carolina Board of Pharmacy can adopt rules to oversee the actions in this bill.
Very good.
Jim,
And
you got a follow-up?
Yes, sir. Do we have also a part of this bill that PBMs will not shift the costs elsewhere?
Representative Ryan.
And I will refer that to staff if that's okay, Mr. Chairman.
Yep, that'll be fine.
Jason Moran Bates, Legislative Analysis. The bill just kind of regulates what PBMs can do with spread pricing, concessions and rebates and that kind of thing. How they do that within the confines of the law is up to them, so I can't really give you an answer to that question.
Good question. You stumped the staff. Representative Clark. And
Thank
Pearl
you.
and Cunningham, and we'll try to do a vote after that.
2 brief questions to the bill sponsor, please. Good. I have tried to run this up the chain to figure out and any questions, and just have 2 concerns that I want to read to you and hear from you, your perspective. So one vice president of a pharmacy emailed, I do fear that they are allowing too open access in this bill where unqualified pharmacies may be dispensing. Can you please respond to that concern?
Can you read that again?
I do fear that they are allowing too open access in this bill where unqualified pharmacies may be dispensing. Is that a concern? Could that occur?
Representative Ryan.
Open access? Do you know what they're referring to?
He read the bill and he just said he's worried that it might allow other pharmacies to dispense outside. I don't know. This is outside of my wheelhouse, so.
The only thing I can think is maybe specialty pharmacies. There's an accreditation process there for specialty pharmacies, which is covered in this bill. So I'm not.
Okay. And then just going back to Rep. Servania's point, that their other concern was that PBMs may retaliate by reducing pharmacy networks or cutting reimbursement elsewhere in unintentional cost shifts.
So if there's any way we can better protect that in the language of the bill, or that was another concern that was raised to me.
Thank you. I will tell you on the sheet that you have in your packet there, which shows just some of the major PBMs, 3 PBMs on 80% of the drug market. There are around 70 PBMs out there across the United States, but 3 of them have 80% of the drug market. The FTC is looking into that as well. There's lots of federal legislation going on with PBMs. Every state in this country has PBM reform legislation that they've either done or are doing. I'm not sure if that answers your concern or not, but wanted to make you aware of that.
Representative of staff has some comment to add.
Yes, Jason Moran, Bates, Legislative Analysis. I do just want to point out a feature in current law. This is going to be 58-56A4, subsection D. A pharmacy benefits manager should not penalize or retaliate against a pharmacist or pharmacy for exercising the rights under this article. So there is some protection that is in current law.
Representative Pirtle.
Thank you, Mr. Chair. I have just a couple of questions. My colleague from Davison made mention of the $10.24 dispensing fee, and some of the concerns that was brought to my attention was that this fee would be passed directly on to the consumer as part of their copay versus something that the insurance company would be an allowable charge to the insurance company. And I have a follow-up after that.
Representative Ryan.
Thank you for that question. We've already seen evidence in other states that have gone to NADAC plus dispensing fee where a reduction in copayment and cost for prescription drugs has already decreased. Those reports are coming out. So that is simply not the case.
Follow up.
Thank you. And I know I think you are a pharmacist, so you live in this world and you're the subject matter expert, so to speak. But as far as the lack of transparency in negotiating contracts, the PBMs negotiating contracts with pharmaceutical manufacturers and pharmacies themselves, I know it's difficult to track the actual cost associated with the true cost. And I know that's one of the barriers, but I guess my question is, with discounts and rebates that we're really not 100% sure of, at least from the community pharmacists that I talk to. I mean, I'm hearing stories where there's occasion where on a particular script, the PBM would make more money than the pharmacy. Have you seen that, or is that something that you've heard of an occurrence?
Ryan?
Thank you for that question. Yes, currently there are many pharmacies who submit a claim for many medications and are not reimbursed and actually have negative reimbursements for the cost of that drug. There are contracts in place that need to be addressed as well. But yes, you are correct. This is why we continue to see hundreds of pharmacies going out of business across our state.
No other follow-up. Then Representative Cunningham, and we've got a few from the public who have signed up.
Mr. Chairman, I just asked you a point of order question.
Yes, sir.
Due to the standard rules of 10 minutes to, will House Bill 491 get a proper hearing today? Are you planning to adjourn at 12? I just want to know where we are now, because I want to make sure we get a proper hearing on 491, if you don't mind, Mr. Chairman.
Good question. If we don't get to that today, because we still have 4 speakers on this bill, we will carry it over to next week. We will give it a proper hearing, though. Thank you for the question. Okay, Cunningham, Representative Cunningham.
Mr. Chair, we're going to hear the public first, and then I'm going to make my motion.
Okay.
Thank you.
We do have 4 have signed up. We will start with Solari, Eason, Dean, and if y'all want to just sort of make your way up.
Mr. Chair, members of the committee, my name is Tony Solari. I represent the North Carolina Association of Pharmacists. First, I want to thank Representative Ryan for bringing this very important bill before the committee. I also want to thank her for bringing all the stakeholders together several weeks ago to work out a compromise, and this is a compromise piece of legislation. Let me say that this bill is important to pharmacists, both chain and independent. It addresses a number of PBM practices that have been driving 3 independent pharmacies out of business every day in the state in 2023. Clawbacks, DIR fees, failure to reimburse adequately. This bill addresses all of those. And as you know, independent pharmacies have a role to play in North Carolina and to this General Assembly in your attempts to reduce healthcare costs and to improve access to care, especially in rural areas. Independent pharmacies have a key role to play there, and we need to preserve their independence and their economic viability. So again, I want to thank you for your bringing this bill forward, and we urge the committee to support it.
Caroline Eason.
Hi everyone, my name is Caroline Eason. Thank you for listening to me today. I'm here as a pharmacy student at UNC Chapel Hill. My family has 3 independent community pharmacies in rural western North Carolina, and hopefully when I graduate I'll be going back home to take those over and care for my community. I'm here today to speak in support of my profession, my patients, and House Bill 163. In rural underserved areas like my hometown, a pharmacy is the primary access point to the healthcare system. It's free, it's readily available. You can give us a call, we're there, we'll deliver to you. Pharmacies are closing across the nation, like Solari said, and House Bill 163 will help prevent those negative reimbursements so that we actually get paid for the services that we do. We keep our patients safe, we keep them, we expertly manage their medications, and we just do so much for them. And also, pharmacy benefit managers steer patients away from our pharmacies to their preferred networks. And this legislation would allow patients their right to choose their care that's closer, care that is just personalized, and we go the extra mile for them. So I urge you to support this bill, and thank you for listening to me.
Thank you. We'll go to Joe Stewart, and then Coggins.
Joe Stewart with the North Carolina Association of Health and Benefit and Insurance Professionals and the Independent Insurance Agents of North Carolina, about 10,000 agents across the state, work with employers and individuals to design health plans that make sense. For employers, the PBM is generally one facet of trying to design a health benefit for their employees. The maximum flexibility for PBMs is important to contain the costs so that the benefits can suit what the employer needs to attract and retain the workers that they want. It's important to remember in any issue involving insurance, whether it's health or property and casualty or any form, if there are increased costs in the system, then that has to be reflected in the premium. The amount that employers pay and individuals pay will be more if the costs are increased to provide the service under that policy. So we just are very mindful of wanting to make sure that anything we're doing doesn't adversely impact an employer's ability to offer the health benefits that they want to their employees. Thank you.
Thank you. Mark Coggins.
Yes, I'm Mark Coggins with the NC Chamber, representing over 800 of our state's employers, large and small, and over 20 industry segments. Thank you, Representative Ryan, for inviting us into the process and having continued conversations. Our lane in this conversation is a defined one. We don't speak on bills unless we believe there to be a direct impact to the employer community on cost or quality. Any mandated dispensing fee or things of sort or price list that drugs can be tied to will likely lead to increased costs for employers and thus their employees. Increased costs in the healthcare system that get talked about so much around here and were brought up by some members today are almost always get passed on to us and the folks paying the bill at the end of the day. The employers and the employees that drive the economy of this state. While we don't oppose reform overall, we do oppose concepts like this. We'll continue to monitor this bill through the process and look forward to continued discussions about reducing costs for our healthcare system. Thank you.
Thank you, and I'll call on Representative Cunningham for a motion.
Thank you, Mr. Chair. I make a motion for a favorable report to House Bill 163 rolled into a new PCS with a referral to regulatory reform and favorable to rules and calendar operation of the House.
You've heard the motion. All those in favor of that motion say aye. Aye. Any opposed? Motion does carry. Okay, I've been told that we can actually go past 12, so I will turn the podium over to Chairman Potts and review the Medicaid work requirement. There are 3 signed up on this list first.
Thank you, Representative Lameth. You're recognized to present your bill.
As I look around, I think most of you were probably here when we did the Medicaid expansion bill. That bill has a couple triggers in it. There is a trigger for work requirement, which basically says if the federal government moves to allow work requirements, North Carolina would also move to allow work requirements. With all the talk in Washington about changes to Medicaid, including changes in the percentages of payment, changes in allowing work requirements, I felt like it was, as I've talked to some of the congressional delegation, I felt like it was important to go ahead and step out and signal that we were, in North Carolina, we supported a work requirement. Just as a reminder, the current bill does allow work requirement if the federal government moves to a work requirement. So while I didn't have to do anything at all, and if that was allowed, it would trigger a work requirement, I felt like it was important, as Representative Pierce pointed out, we need to have a debate and discussion and get the mood of the General Assembly. We do have new members, things do change. We do need to see if there's a willingness to move to a work requirement if that is allowed at the federal level. So this bill is fairly short. It just simply says that if the feds allow a work requirement as a part of the Medicaid expansion, North Carolina would be there as well to require a work requirement. Now within the bill, there are some exceptions. And I think most of you may recall that we have a jobs training program. I think there are things that we can continue to do to help these individuals that are in a program to try to improve their economic standing. And that's something when the time comes we'll have to deal with if we get to that point. I'm hoping by signaling that we're okay with a work requirement that they'll get off the idea of changing our funding formula. If the funding formulas change, even a small 1/10% or 1%, it is a major economic impact to North Carolina, and we hope we don't have to go down that path. But as I've said to many of my colleagues who've asked me about the federal cuts that this body may have to be faced with at some point, if we're asked to reduce the 90-10 to a lower federal number and a higher subsidy from the state or the hospitals, what do we do? Well, we don't know right now, and that's also why I've proposed a bill that would study these different options. So this one just limits the discussion to a work requirement that basically reiterates what the current expansion bill already says, signaling to the folks in Washington that we would be supportive of that if we got to that point. And with that, I know there's some public who would like to speak. I'll be glad to take any questions.
Thank you, Mr. Representative Lameth. Did you have a motion or did you have a comment, Representative Honeycutt?
I did have a comment, but I'm going to hold that, Representative Potts, and let the public go.
All right, thank you. Rebecca Cerise, you have 1 minute since we're over time. We have a soy barbecue planned at Representative Crawford's office afterwards. But at my office, we're going to have steaks from Representative Gillespie's. You're recognized to speak.
Thank you. I am the health policy advocate at the North Carolina Justice Center, and I'm here to express my concerns about HB 491, which calls for the work reporting requirements. But first, I want to say thank you, of course, for passing Medicaid expansion for the 640,000 people whose lives have been transformed. Medicaid expansion has been a game changer in every single county in our state, which is why I'm deeply concerned that establishing Medicaid work reporting requirements could jeopardize access to essential coverage and also cost North Carolina taxpayers millions of dollars, money money better invested in job training or increasing reimbursement rates to providers to strengthen the program. Also, the vast majority of people eligible for Medicaid are already working, around 60% of Medicaid enrollees. For the remaining 40% of people who are not, it's because they are disabled, too ill to work, attending school, or they're caretaking for family members. One such person is Henry Medlin, a Beaufort County resident who had to quit his job in aviation to care for his aging parents. And Medicaid has allowed Henry to address his own health needs so he can be a better caretaker for his father, who is a Korean War veteran. Please consider that. Thank you.
Thank you. Chi Wong. Didn't get that correctly. I apologize.
No worries. To the members of the House Health Committee, my name is Dr. Chi Wang. I'm a physician. First of all, thank you so much to the General Assembly for allowing 640,297 people in North Carolina to have Medicaid. Time and time again, I sit in front of patients each and every day, asking them when they want to receive health care. People like Elsa will tell me, I want to go home, I want to be discharged. And I ask them why they want to be discharged from the hospital, because it's too early for them to go home. And they tell me, I want to go home so I can go to work, take care of my mother with metastatic breast cancer, and take care of my daughter who wants a second pair of jeans. My ask and my question to all of you guys is, when we do the work requirements, for us to allow them to check off the box, make sure they're doing the work, but also allow them to continue on with their days so they can juggle the many things that are faced with each and every day. Thank you very much.
Mark Swallow.
Thank you. Mark Swallow, Democracy Out Loud. So there's a Kaiser Family Foundation report that was published in February, a month and a half ago, and it had 5 key facts. Most Medicaid recipients work, as you heard. Only 8% do not have employment or were working as students or caregivers. The Congressional Budget Office found that estimated if federal requirements existed, it would not lead to further employment, just uninsured. In Arkansas, where they implemented work requirements, 18,000 people lost Medicaid coverage, which is 25% of all people. Evidence shows that Medicaid work and reporting requirements are confusing to the enrollees and complex and costly for the states. So many employees were not successfully contacted. They lacked computer literacy and internet access, and involved tremendous changes in the system in order to support it. In fact, Georgia spent 80% of their costs on program administration and consulting fees versus just providing coverage. And research shows access to affordable health care and promotes individuals not having health care and impact the ability of the people to work. Sorry, thank you.
Thank you. Any further comments? And not Representative Biggs?
I have a motion at the appropriate time.
Representative Cunningham?
I don't have a motion, but I do want to speak to the bill.
You're recognized for 34 seconds. Go right ahead.
You just wasted that. Thank you, Mr. Chair. So,
I love you, Representative Cunningham.
I know you do. Anyway, Representative Lambert, I know when we worked on the Medicaid before, the issue came up about the work requirements before we were able to expand, and we had come up with an option on the table for it. But since we have the trigger in of that 90%, that's where the issue really falls, that we will pull back from the Medicaid. And I know everybody is anxious. Everybody don't have certainty right now, and so everybody's on edge. And I think we all need to settle in a little bit and see what actually happens. And I think if we have to do this and not lose Medicaid, it's an option on the table, because we do know 80% of those individuals do work. But we also know after we expanded Medicaid that the substance use population overdose deaths went down significantly in North Carolina, and most of those individuals are not working while they're in treatment, especially if it's long term. So I'd be interested in seeing the list of who's going to be exempted. Thank you, Mr. Chair.
Thank you.
Chairman,
Pierce.
I'd like to request a roll call on yeas and nays. Vote.
We can do that. It'd make me late for my barbecue, but we can do that.
Okay. We don't need that barbecue anyway.
This time, Representative Crawford, you have something, a motion?
I don't have a motion, but I do have a question.
Ask away.
Thank you, Mr. Chair. Representative Lambeth, can you speak to the resources that DHHS would need to carry out the administrative burden on verifying work requirements if that should come to pass? Does this bill address any of that funding that might be needed for that administrative work?
Representative Lambert.
Yeah, thank you for that question. It does not address that. This is almost a what if we get to the point where they give us some time to adjust for modifying those who are on the current Medicaid expansion and have to be taken off, we would have to figure all that out in terms of how much it would cost and then how much it would cost to then monitor that. In early bills that I submitted, they all had a work requirement, and in those work requirements, we did allow a portion of the income that came in to go to HHS or be retained by HHS to monitor or administer that work requirement system. But do I recall how much that was? No, I don't.
We'll hear from Representative Wansey, and then I'm going to entertain the motions because we're going to have a roll call vote. Thank you.
Thank you, Mr. Chair. My question has been asked and answered.
Representative Biggs.
I move that House Bill 491 be given a favorable report and with a re-referral to rules.
Thank you. You've heard the motion. At this time, we'll take a roll call. The clerk will call the vote.
Representative Ball?
No.
Representative Ball, no. Representative Belk? Representative Belk, no. Representative Biggs?
Yes.
Representative Biggs, yes. Representative Blackwell?
Yes.
Representative Blackwell, yes. Representative Brockman? Representative Buwansi?
No.
Representative Buwansi, no. Representative Campbell?
Yes.
Representative Campbell, yes. Representative Carney? Representative Carney, no. Representative Cervania?
No.
Representative Cervania, no. Representative Chesser?
Yes.
Representative Chesser, yes. Representative Clampett? Yes. Representative Clampett, yes. Representative Clark?
No.
Representative Clark, no. Representative Crawford?
No.
Representative Crawford, no. Representative Dixon? He's not here. Representative Gillespie?
Yes.
Representative Gillespie, yes. Representative Liu? Representative Loftus?
Yes.
Representative Loftus, yes. Representative Miller?
Yes.
Representative Miller, yes. Representative Pare?
Yes.
Representative Pare, yes. Representative Pierce? Representative Pierce, no. Representative Pirtle?
Yes.
Representative Pirtle, yes. Representative Ryan?
Yes.
Representative Ryan, yes. Representative Scott? Representative Scott, yes. Representative Wheatley? Representative Wheatley, yes. Representative Potts?
Yes.
Representative Potts, yes. Representative Lambeth?
Yes.
Representative Lambeth, yes. Representative Reeder?
Yes.
Representative Reeder, yes. Representative White? Representative White, yes. Representative Cunningham?
Abstain.
Representative Cunningham, abstain. Representative Humphrey?
Yes.
Representative Humphrey, yes.
The committee will stand at ease for a moment till we tabulate the votes.